Good afternoon. I'm Mandy Cohen. I'm the Secretary of the North Carolina Department of Health and Human Services, and today I'm joined by Director Mike Sprayberry. Cameron Larson and Brian Tipton are American Sign Language interpreters, and Jackie and Jasmine Matevier are our Spanish translators. I'll start with a rundown of the numbers. As of this morning, there were 180,754 laboratory-confirmed cases, with 1,222 new cases reported today. 928 people are currently hospitalized, and sadly, there have now been 2,990 deaths. Today, I want to update you on the meeting Governor Cooper and I held yesterday with Dr. Deborah Birx, the White House Coronavirus Response Coordinator. Dr. Birx is visiting more than 30 states to talk about overall COVID response activities, with a focus on the growing number of cases across the country stemming from the opening of colleges and universities. We really valued the opportunity to share with Dr. Birx how North Carolina has been making progress in our fight against this pandemic and how our dimmer switch approach to easing measures has helped distinguish us from others in the South who have faced greater setbacks. While we have higher rates of cases per capita than the nation for the last 7 days, we have one of the lowest rates of viral spread in the Southeast region, validating the need to stay the course. We also need to double down on wearing masks and social distancing. Dr. Birx lamented seeing people without masks while in our state. She emphasized the need for strong and persistent messaging on prevention and commended the state's new Get Behind the Mask public campaign. She wanted us to keep reminding people that anytime you are with people who don't live under your roof, you should be wearing a mask, whether you're with friends or family or out in your community. We also discussed ways to curb viral spread at our colleges and universities. North Carolina, as much of the country, has seen a rapid increase in cases and the percent positive amongst 18 to 24-year-olds following the beginning of the school year. We are keeping an eye on these trends, particularly as many universities have sent students home. We agreed with Dr. Birx on the importance of widespread testing on college campuses and talked about our work with higher education institutions and local health departments to help surge testing resources for the on and off-campus community. We want to ensure isolation and quarantine capacity and support their proactive surveillance strategies. Dr. Birx offered federal support to help surge testing on college campus, which we greatly appreciated by both, it is greatly appreciated by both the state and our campus communities. Governor Cooper also outlined several areas where North Carolina has pressing needs for federal assistance and support. The first area where we requested federal support is on prevention of viral spread. As I mentioned, we talked about our 3 W's campaign and our push for North Carolina to get behind the mask. And we discussed the importance of federal alignment and support on that public messaging campaign. The governor emphasized that we need national leaders to model effective prevention strategies like wearing a face covering and waiting 6 feet apart, and for them to take these measures to protect North Carolinians when visiting our state. And I really want to thank Dr. Birx for supporting, modeling, and reiterating that message in her public engagements and interviews when she was here in North Carolina yesterday. The second priority we talked about was clarity and support around testing. We discussed the progress we've made and continue to make here in North Carolina on testing access, and we talked about the need for proactive federal leadership on this front. We also discussed details about the federal government's inventory and distribution plans for those new rapid tests. Dr. Birx shared helpful guidance on where to deploy different types of tests, and I'm hopeful that her recommendations, which were great, will be shared more formally so that we're all aligned. Third, we discussed the need for federal funding to states that matches the scope of this emergency. The governor's specific requests included funding for personal protective equipment through FEMA, funds for continuing support for child care programs, and the extension of flexible federal emergency nutrition assistance past the end of September and continuing that flexibility for students in hybrid learning environments. Lastly, we emphasize the need for clear federal guidance to states on planning for distribution of any future vaccine. Here in North Carolina, we've prioritized transparency, evidence, and clear expectation setting in all our actions and communications around this pandemic, and that this approach is what we're going to take as we think about distributing a safe and effective vaccine. In the meantime, our best evidence tool continues to be prevention. While our trends and indicators continue to show gradual but steady progress in slowing the virus, this progress is fragile and, frankly, not as good as we or Dr. Birx or the White House would like. We continue to simmer, and while we have avoided boiling over like some other states, some parts of our state have plateaued at a stubbornly high rate of viral spread. This week's report from the White House Coronavirus Task Force has North Carolina in the red zone for cases. While Dr. Birx noted that North Carolina has done a good job avoiding the surges that plagued the South and other parts of the country and commended our efforts, she did emphasize that continued vigilance was paramount. The recommendations in the White House report are consistent with our dimmer switch approach, and we urge continued caution. That means practicing the 3 W's. That's right, wearing a face covering over your nose and mouth, waiting 6 feet apart, and washing your hands often. That's wear, wait, and watch. And whatever your reason, get behind the mask. And with that, I'm going to turn it over to Director Sprayberry for a few remarks, and then we'll take your questions. Director Sprayberry.
Thank you, Madam Secretary, and thank you for your leadership. Good afternoon. Today is day 185 of the State Emergency Operations Center's COVID-19 response. Yesterday, I was honored to participate in the meeting with Dr. Deborah Birx, the one that the Secretary was just talking about. She's the Coronavirus Response Coordinator for the White House Coronavirus Task Force. We held a detailed discussion on the continued need for flexibility and support from federal funding sources, such as PPE through FEMA, the need for extension of vital programs like the Pandemic Electronic Benefits Transfer Program, and additional funding for child care, as well as additional laboratory and testing supplies to support expanded capacity. These are important needs in these critical times. Today is the climatological peak of hurricane season, and the tropics are extremely active right now. There are currently 2 named storms in the Atlantic and 5 tropical areas of interest that the National Hurricane Center is currently tracking. While none of these storms pose an immediate threat to North Carolina, we will continue to closely monitor them over the coming days and weeks. Now is the critical time for everyone to be aware and prepared for tropical weather impacts. If possible, make sure your family has a plan to stay with a family, a friend, or at a hotel if you have to evacuate due to a hurricane during the COVID-19 pandemic. Having a plan costs nothing, and every household should have one. The state will have non-congregate and congregate sheltering available, but it's best to stay away from shelters if you can in order to minimize contact with others. Also, make sure your emergency kit is ready and includes the necessary items to stay healthy during COVID-19, such as face coverings and hand sanitizer. If you have questions about emergency planning, please visit readync.org for more information about plans, preparedness kits, and evacuations as part of your Know Your Zone initiative. We can't overemphasize it. Now to an update on our current disaster recovery efforts. Recovery continues after the EF3 tornado strike in Bertie County during Hurricane Isaias. We are focusing our work on moving families out of hotels and into temporary housing. We also continue to work with our local and FEMA partners in eastern North Carolina. Isaias impacts. These joint preliminary damage assessments will determine our ability to request a federal major disaster declaration for those areas impacted by the hurricane. Over in western North Carolina, a disaster recovery center remains open in Allegheny County for residents to apply for assistance after the earthquake that struck the Sparta region on August the 9th. More than 150 home and business owners have visited so far, and the recovery center will be open through 6 p.m. tomorrow. We encourage individuals that need assistance to visit the center and register. Governor Cooper requested and obtained disaster declarations from the U.S. Small Business Administration for both the tornado and earthquake events. Applications can still be submitted online at disasterloan.sba.gov. That's disasterloan.sba.gov. He also signed Type 1 state disaster declarations for both events to provide state-funded individual assistance grants to those who don't qualify for SBA loans. With tomorrow being the anniversary of the 9/11 attack on this nation, we would ask that you take a moment to reflect on the sacrifice that many Americans made in the face of that tragedy. We have men and women that are still continuing to serve here and at home to protect the homeland. We offer them a special thanks for their dedication and service. Just like Secretary Cohen said, remember that now is the time for whatever your reason, get behind the mask to wear, wait, and wash. Wear a mask, wait 6 feet apart, and wash your hands frequently. This is how we slow the spread of the virus, working collectively together. We have the power. As always, don't forget to look out for your family, friends, and neighbors. Call your loved ones daily. With kindness and cooperation, we will all get through this together as one team, one mission, and one family. Thank you.
Great. Thank you, Director. And with that, we will take your questions.
Our first question today is from Claire Donnelly with WFAE Radio in Charlotte.
Hi, I'm Claire Donnelly with WFAE. The nursing home White Oak Manor in Kings Mountain has 168 cases of COVID. That's more than any other congregate living setting in the state. Do you have any idea why this facility has such a high number of cases? And can you tell me what DHHS is doing to help that facility?
Thanks, Claire. As we've talked about many times through this pandemic, we know that congregate living settings like this one, that is a long-term care setting, is very vulnerable to this virus. You have folks who are living close together as well as they are medically vulnerable. So it has been a big effort that we have made since the beginning of this virus to make sure that we are both preventing virus from getting into places and as well as ramping up testing to make sure that we can understand scopes and if the virus does enter one of these facilities to immediately do on-site infection control and prevention. So we have an entire strategy we've gone through many times around prevention and testing, around helping even with staffing, infection control, as well as oversight. So we do have a survey team that goes into facilities when there are outbreaks. Again, these are in our skilled nursing facilities of White Oak Manor is not a skilled nursing facility, so it is slightly overseen in a slightly different way. But again, when we see these, we work closely with both our local health department and with that facility specifically to make sure we can contain the virus as well as do ongoing testing week over week. Thanks.
The next question is from Lynn Bonner with the News and Observer.
Thank you very much for taking my question. If President Trump had disclosed publicly the knowledge that the virus was serious when he knew about it back in February, would the state have shifted its public behavior in a meaningful way?
Well, Lynn, thanks for that. I think the state had been preparing for COVID before it even had a name. We'd had multiple pandemic plans in place, and back in January, well before we saw a first case here in North Carolina, we were already activating our work here to prepare. And I think you'll remember that we took early and aggressive action once we did have some cases here, that we went to a full stay-at-home. We were able to keep the virus level very low while we built our capability to respond to this virus. We, at that time, back in March, remember we had no testing, we were struggling to find PPE, and we've come a long way. We both know much more about this virus now, how it is transmitted, how we can prevent transmission, and so we've done a lot of work to make sure that we have our capacity to respond, but also know how to prevent the spread of this virus. I think as we've been talking about today, unfortunately, in North Carolina, we've been we've plateaued at this stubbornly high rate of viral spread. And I know that we can head back in the right direction. We started to do that at the beginning of August. Then we had our higher ed and other university settings open. Then we saw an increase in cases. I know we can head back in the right direction if we all work together. And the thing about, that I think I'm very proud of North Carolina's work is that we have pulled together as a state. It's been hard. There have been challenges as we've gone through this, but we've worked together as a state, and we're going to need to continue to do that. I think our success, as you look at us in comparison to the rest of the Southeast, is because we have gone slow. It's because we have required masks. It's because we ask folks to continue to social distance. And that's what we need to continue to do, particularly as we head into the fall. And we know flu season is coming as we get into the fall and to the winter. So we have a lot of work to still do, but we know and we have learned a lot since February and March in terms of how to prevent viral spread. Thanks.
And there's a follow-up from Lynn Bonner.
Thank you very much. In the summary that Governor Cooper's office supplied, there were lots of requests listed there. I'm wondering if you have any top priorities and whether the notation about modeling of behavior was, if you were thinking about President Trump when you made that request.
Thanks for that, Lynn. So our top request was around prevention. We are at a high level of viral spread in North Carolina. As I mentioned, the White House task force rates us as a red, right? The highest rate of viral spread, one of the highest rates in the country. So we take that very seriously. We know we have work to do. And it means we have to focus on prevention. So what we talked about was our campaign, the Get Behind the Mask campaign, and other really important prevention efforts. Masks, social distancing, et cetera, using our dimmer switch approach. Those are all prevention activities. Dr. Birx was very complimentary of that, and we talked about the need that when visitors come to our state on either side of the aisle, whether it's the candidate, their surrogates, and they're bringing people together, we need to make sure that we continue to do our prevention efforts, masks and social distancing. And I do want to thank Dr. Birx in all of her public engagements yesterday. She was wearing a mask, she was social distant, and she was reiterating those messages. So she very much heard the governor's request loud and clear, and very much was role modeling that, and I want to really thank her for that. And that's what we want to see from everyone, whether both sides of the aisle, surrogates, candidates, as well as those who are attending. It doesn't mean you can't attend, but if you do attend those events, please have a mask and do socially distant. Thanks.
Next question is from Justin Schreier with WXII TV in Winston-Salem.
Good afternoon, Dr. Cohen. We spoke with several bar owners today who were all visited by alcohol law enforcement in the Winston-Salem area after some of them had opened up. They all say that they can safely open just as restaurants and other establishments have. Do you believe that keeping bars shut down is still in the best interest of public safety? Thank you.
Thanks, Justin. Well, I should start by saying we know that this virus has been incredibly challenging, and it has kept businesses closed that unfortunately are the kinds of businesses where we know the virus spreads the most. And bar situations are one of the things that are the most high risk. And part of that is because it is by nature a gathering point, and you also, to drink, you need to take off your masks. So it is really a challenging part of having the high level of virus spread. If you, again, in our discussion with Dr. Birx yesterday and the weekly report that we get from the White House, it continues to tell us here in North Carolina to keep our bars closed. And so we are heeding that advice from the White House to keep bars closed because of the high risk nature of the setting. I want to say to the bar owners that none of these decisions are easy. I definitely think that we need to make sure we are helping these businesses through this really, really challenging time. We want both them and their customers and their communities to be safe. I mean, and that is really why we put together these restrictions at this time. But we also want to make progress. I should say we can make progress, but we need to see our level of viral spread go down. We cannot be in the red zone. We need to head towards that green zone. And we know how to do it. It's masks, it's social distancing, it's washing our hands, it's those 3 W's. So we're going to keep on that, and you're going to keep hearing that from me because we can make progress across the board and to continue to ease additional restrictions. We want to do that. I know the governor very much wants to do that. So if we all work together, we're going to get there. Thanks.
Next question is from Tina Terry with WSOC TV, Charlotte.
Good afternoon. We know that the CDC is visiting several facilities today, including the Citadel Salisbury, which had one of the largest outbreaks in the state earlier this year. A spokesperson for the owner of the Citadel has attributed some of the recent issues to the large number of positive cases in Rowan County, basically saying the infection rate per 100,000 residents is among the highest in the state, and the percent of positive tests is 9.09, which is much higher than the state average. Are you concerned about the rate of infection in Rowan County? Should there be more restrictions implemented there? And do you believe this has contributed to outbreaks at the Citadel and other nursing home facilities?
Well, thanks for that question. One of the things we talked about with Dr. Birx while she was here is that the rate of viral spread in communities impacts what happens at long-term care or other skilled nursing facilities. If there's more spread in the community, it is more likely that that virus is going to get into those spaces. So the best way that we can protect those who live in long-term care facilities or in our nursing homes is to all work together to lower the spread of the virus. What I would say is I don't know the Rowan specifics. I'm happy to look at Rowan specifically, but I would say to the local officials there, they are always should be looking at their own data, and we set a baseline here at the state, and if based on their data and their numbers they feel like they want to be more restrictive and more protective, we support that. And we are seeing municipalities and localities do that, go beyond sort of the baseline that we're setting for the state and take more protective measures. So we very much support that, and I can go back and look at Rowan's data specifically. Thanks.
Next question is from Liam Collins with WITN TV.
Hi, Secretary Cohen. This is Liam Collins with WITN. With the holiday that just passed, what are the concerns that the Department of Health and Human Services may have about an increase in cases, considering the state has made some good progress, as you mentioned, in the past? And with that being said as well, what can people do if they did attend a Labor Day celebration to make the department's job easier in contact tracing specifically? Thank you.
Great. Liam, thanks for that question. As we talked about before Labor Day, we were concerned about this because what happened Memorial Day, July 4th weekend, is that, folks get together. It's a time, understandably, of celebrations, of family traditions. And we wanted to have folks remember that even if someone is in your extended family or your close friends, they can not know they have the virus and they can transmit it to you, or you could have the virus and transmit it to someone else. It's actually something we spent a fair amount of time talking with Dr. Birx, and I know she mentioned in a lot of her press engagements afterward, was that folks in even small gatherings like backyard barbecues are at risk of contracting COVID-19. And so we definitely put out messages, again, the same things, the 3 W's, wearing a face covering, be socially distant, and washing your hands. So that was really important. Now, we're only a few days after the holiday right now, so we don't yet know what the impact might have been. We'll continue to watch our trends. What I would share with folks is if you have been in a social gathering, if you have had exposure risk, certainly if you're having any symptoms, get a test. But if you had exposure risk, we would recommend getting tested. There's more than 600 sites to get tested, different kinds of testing modalities. Turnaround times for those results have really been low, 1 to 2 days. We post that on our dashboard. So we would encourage folks to get testing. And if you are found to be positive and you were part of a gathering, a backyard barbecue or what have you, please work with your local public health so that we can inform others who may have been there or in other places where you might have exposed others. So really important to pick up the phone if your local health department's calling, or be proactive and reach to them and say, how can we work on making sure I'm alerting others about spread that might have happened in my community or that I was exposed to. So thanks for that, Liam.
Next question is from Brian Anderson with the Associated Press.
Hi, Dr. Cohen. Brian Anderson here with the AP. Thanks so much for taking the time and the accessibility. I had 2 questions. I'll do the follow-up after. It's more political in nature. But going to college campuses, like you said, can you just sort of talk about what you're seeing as far as community spread in Raleigh, Chapel Hill, and Greenville areas, those being the towns and cities where NC State, UNC, and ECU are, and then I'll have a follow-up for you after that.
Sure. Thanks, Brian. Obviously, with transmission starting in the 18 to 24-year-old population, what we are watching is to understand, is it staying with the students or is it moving to other populations within those communities? I think we're still looking at the data and understanding that. We are certainly seeing, particularly out east, more cases of COVID-19. So we are watching that very closely, particularly in these college towns. We're encouraging everyone in those settings to get tested if you think you've had any exposure to students or to campus activities. So again, very important there, and then happy to take your follow-up.
Yes. My second question was with regard to President Trump's appearance in Winston-Salem. There's a First Amendment exemption in Governor Cooper's executive order that allows for sort of a special carve-out for these gathering limits that seems to weaken enforcement. Would you encourage the governor to rescind that exemption? And for example, what would prevent President Trump or any other candidate from holding a large rally in a bar or another place and say that is for First Amendment purposes? Thank you.
Well, thanks, Brian. I think first, before we get to thinking about even like mandates and enforcement, I think it starts with leadership. We know we're in the middle of a pandemic. We know that COVID-19 is here in our communities. I would hope that our leaders would demonstrate and role model the kinds of activities that we know slow the spread of the virus, whether there's a mandate or not. This is really just about us all working together on one team, one mission, one family. That's Director Sprayberry. That we all need to work together. So this isn't really about mandates and enforcement. It's about leadership. And I think it's an important moment in our country, and particularly in this state, as we are simmering. We have a high level of viral spread. And we need to get that down so we can make progress on opening other businesses. We can make progress on further easing of restrictions. But we need leadership, and I think this is an important moment for our leaders to recognize the importance of their own personal actions in this time. No one's perfect. I'm not asking for perfection. What I'm asking for is for everyone to do their best, to wear a face covering, to be socially distant, and wash their hands, the 3 Ws.
We'll take our final question today from Travis Fain with WRAL.
Yeah, thank you, Secretary Cohen. I'm interested in what you're seeing as far as outbreaks or lack of outbreaks in schools that have reopened for in-person teaching, both in-state, nationally, perhaps even internationally. What is that telling you about transmission rates, particularly for young children, and how is that informing our own plans going forward?
Great, Travis. Thanks for that question. We are monitoring closely the school districts that have chosen to move forward with an in-person teaching option. As you'll remember, back in July, the governor, myself, we encourage folks to choose that option for in-person learning because we think there are so many benefits to being in the classroom. But we also need to follow protocols. And those schools that are opening are having to use a lot of the safety protocols, like wearing masks for everyone, screening on their way in the door, socially distancing within the classroom, and making sure that there are not as many people within each building or in each classroom. So I think things are going very well. We have seen a couple of K-12 outbreaks. They tend to be in a couple of high schools, but it's been pretty limited, and particularly limited for our younger elementary age folks. And that seems to be consistent with what we're seeing around the country and what we're seeing in research that shows that under the age of 10, children seem to get COVID less often, transmit it less often, and get less sick. Again, that doesn't mean they can't ever get it. They can get it. They can transmit it. It just tends to be less often. I think that's consistent with what we're seeing initially in our schools. But what I'd say, I think we're on starting the week 4 right now. So I think we just need to continue to watch our trends. We're only a few weeks in. And so we want to make sure that we are really understanding the data and the trends here. So I want to give it a bit of time, but I also do want to encourage the schools that started full virtual to learn lessons from the school districts that did start in person on both how to implement those protocols, how it's going, and other lessons learned. So we're hoping to facilitate some of that learning across our state as well. Thanks for that, Travis. All right, I think that was our last question for the briefing here today. So thank you again. I will continue to ask for everyone's help in getting our virus level low, to wear your face covering, to wait 6 feet apart, and wash your hands. And whatever your reason, get behind the mask. Thanks so much.